number of cases dwarfs all the combined cases in all the past outbreaks. So it's primarily confined to obviously West Africa and the Liberia, Sierra Leone, and Guinea. So this is case counts as of last week. You can see that we have over 6,000. Of course, the numbers are going up since last week, and you can see the breakdown. I won't spend too much time in it. One thing to note, and I think it's relevant, especially given that we've had a case diagnosed here in the U.S., is that the case in Nigeria, that was an imported case from Liberia. And you can see that with good public health and quick action, we were able to contain that outbreak in Nigeria with only 21 cases ultimately reported. So for us, that was a real success story. I think one that's a very reassuring message for what we're experiencing now in the U.S. Some challenges that we're facing in West Africa, and provide some perspective of why we're experiencing this outbreak, is there's just an overburdened public health and healthcare system in these countries. It's just the resources are not there to provide the infrastructure and the support that's needed to contain this type of an outbreak. There's just the resources can go on what's needed, but the number of healthcare, the treatment facilities, protective equipment to protect the healthcare workers and other people responding to the response, and medical supplies. So again, it's just a lot of challenging conditions in terms of case investigation and tracking down contacts that again are very unique to that setting. In terms of prevention, I know a lot of you probably been following the news, so hopefully not much of this is going to be new information for you, but I like to consider this, especially for those of you who aren't healthcare or wouldn't be practicing healthcare in that setting. It's really more of a common sense approach to staying protected during any time that person might be in that area. One is just practicing careful hygiene, washing your hands with soap and water, avoiding contact with blood and body fluids, and that's defined very broadly. Handling items, avoiding handling any items that may come into contact with an infected person, such as clothes and bedding, certainly needles and medical equipment. And then avoiding hospitals. So if you're in that area and you're not providing health care or supporting that particular response and supporting that particular area of response, avoiding Ebola treatment facilities and healthcare facilities is very important. And of course, burials and funerals. With regard to travel, CDC has issued a warning level 3 and does not recommend should avoid all non-essential travel to the areas Guinea, Liberia, and Sierra Leone. We have a traveler's website, and so you can get up-to-date information if any of that changes. Nigeria and the Democratic Republic of the Congo are level 2 travel notice. So what's CDC doing? We have activated our Emergency Operations Center to help coordinate and provide technical assistance. Obviously, it's a very large response and lots of moving parts, given that it has an international component. USAID is the lead federal agency for this response, and we're coordinating obviously with them very closely in terms of identifying what the supplies and what the needs are, and going through them to make that happen and get the necessary resources to the area. We also are deploying staff. Our staff are not providing clinical care. Our staff, we have over 100 people deployed to those affected countries, and this staff are primarily providing the epidemiologic support, so looking at the data, looking at the cases, and trying to help have a better perspective of a clear picture of what's happening in the outbreak, so that we can target and focus our resources to contain it. Again, we have a number of activities, especially related to health promotion. So we're trying to in the African setting, we're trying to better improve communications and understanding of what is Ebola. There's a lot of myths and concerns about really what it is and how do we stop it. And that's a big concern. So we have health promotion, health communicators that are developing in the appropriate languages to better help the community respond. I think there's a couple of slides that maybe didn't make it in here that I wanted to talk about. So let me take a step back. In terms of the perspective on the epidemiologic perspective on the outbreak, the World Health Organization recently recently published a paper in New England Journal of Medicine that described the outbreak. And there's really nothing unusual or special about this particular virus. It hasn't mutated. It's not anything like that. And it really fits with the previous outbreaks. The case fatality rate, so the percentage of cases who ultimately die from the Ebola is 70%. The median age is 32 years old. It's evenly split between male and female cases. And what's been really, I think, getting a lot of news is the healthcare workers that have become infected. So 151 have died out of a total of 318 healthcare workers. Let me see if there's another few slides that didn't quite make it into the presentation. Again, we're partnering with telecommunications and other external companies. We're assisting in trainings, recruiting national emergency call centers. We're establishing emergency operations centers in these countries. So we're trying to build that infrastructure to allow them to better respond by country. And of course, it's very challenging when you're trying to coordinate across multiple countries. And of course, there's also the surrounding countries who want to plan. So for instance, if there's a case that is ultimately identified in the surrounding countries, they're wanting information from us, and so we're trying to provide that information to them. We have a very close relationship through our Division of Quarantine and Global Migration, and so we're working very closely with the airlines and the airports and the ministries of health to establish screening facilities. We've helped to support and to provide direction in terms of exit screening in these countries so that people who are showing signs or symptoms or have had previous some known exposures to Ebola patients would not be allowed to board a plane and exit the country. Again, there's a lot of regulatory authority that comes with a quarantine station, and they're providing that expertise. And again, we are closely monitoring and developing guidance for domestic response, and particularly infection control. We have plans in August that we were developing in terms of if a case was identified in the United States, how would we respond and what information was needed. So we quickly issued infection control guidance domestically for domestic cases, which is actually different than the infection control guidance that World Health Organization and others have issued for treatment facilities in Africa, because again, very different scenarios. We issued EMS guidance, which actually is very critical for the transport of the patient. And so we're also working on domestic communications as well. We're keeping our website up to date, and so as new guidance is developed in response to the needs of the Ebola outbreak. So I encourage all of you to please go to the CDC website and check out all the latest information on the outbreak. And I think I'm going to hand it over. We're going to wait and hold for questions until the end of the speakers, and so hold for questions until after that.
Thank you so much for that overview of what the CDC is up to. I think that what we've learned from that overview is that this is a very complex process. It's taking place in an emerging market. It's clear that this has been around for a while, but nevertheless, the numbers of fatalities are becoming clearly unacceptable. And of course, the most recent outbreak in Dallas has gotten even more attention to this disease. I think one thing that we've learned, and no bones about it, International SOS, we're a for-profit company. We work for subscribing clients, and we've been asked to move people from West Africa. And what I've learned from that is that different companies have different triggers, what they're going to use, when they're going to move. And a lot of that is determined by what's the benchmark in their particular industry segment. And the other one is what do they do for a living? So, for example, a financial company or a big pharma company that might, for whatever reason, be working in Western Africa, they'll have a much lower tolerance and will move very quickly out of the affected region for fears of anybody becoming exposed. On the other hand, if you're an NGO or a scholastic client, their tolerance seems to be much higher.